Welcome back to the channel. It's Dr. Durst. If you are new here, I am a traditionally trained physician that now specializes in regenerative medicine with a focus in sexual medicine. So a passion for non-traditional treatments that don't involve surgery or medication. So if you like that kind of content or what you are about to see, please like, subscribe, and share with friends because it does help the channel and get more of that information out there. So today I want to talk about BPH. So what is BPH? BPH is benign prostatic hypertrophy. It's a very common condition, symptoms mainly over the age of 50, but it increases in frequency with age. The prostate is basically a gland that's helping to liquefy semen, and it is surrounding the urethra at the neck of the bladder. The symptoms that you can imagine are urinary symptoms, and that might be what you're experiencing. So you have a weak flow, maybe you're dribbling, maybe you have a start and stop, you might have a urge to go, you're getting up in the middle of the night, but then you can't empty your bladder, you have a frequency. So all of that puts you up for a risk for increased urinary tract infections. You have some retention of urine that you're not getting rid of. You might have some irritation with the bladder because of that retention of urine, so you can have blood in your urine. You can also have an elevation of your PSA, which might make you concerned you have prostate cancer, but it isn't a cancerous condition. It is a benign condition that can cause enlargement of the prostate, a shrinkage of the urethra, and urinary symptoms related to it. Typically, what treatments we're looking at are medications. So if you go to the urologist or your primary care doctor, they can do some tests, which might include a urinalysis or a PSA. They can do urodynamic tests, but typically you're going to end up being placed on some medications, and those medications could potentially have side effects. And a lot of those, such as Flomax, might have effects on your blood pressure. So you might get dizzy when you stand up after. So medications do have side effects. Testosterone converts to a stronger metabolite, which is dihydrotestosterone, and that can cause symptoms and enlargement of the prostate. So you can block that conversion with a medication that could potentially still cause side effects. So what are some things that you might be able to do? Just increasing hydration, more fruits and vegetables, healthy diet, and more exercise could potentially, but again, hopefully you're already doing all of those. So what is a supplement that you may not have thought about? And we have done a previous video on it, but Pygium, which is an African prune tree supplement, basically has lots of studies support. There was a meta-analysis done in 2000 that showed great effects. You were twice as likely to have symptom improvement if you did Pygium. It's supposed to help with prostate size and health. And so basically increases your urinary improvement, so your flow is better, you have less retention, and those urodynamics are better with it, and twice as likely to have improvement of symptoms. So just think there's a supplement out there that you may not be thinking of, but it also has an added benefit, and we have a video on that, which could increase your ejaculate volume as well, which could increase your orgasmic strength. All of those are good things, guys, so something to look at. We usually carry medical grade supplements in our office. So I'm going to put some, we haven't found a medical grade supplement with Pygium yet. So if you have one, please leave it as a comment. And if not, I'm going to have some links in the show notes where you can get Pygium, and I want to hear your feedback. The jury was in on our previous videos that it works for increasing your load. So I would love to know if it increases your urinary symptoms. Let me know if you want to hear anything else, because I'm willing to deep dive into anything wellness or sexual wellness.